Greetings. My name is Dennis Hammond, and I'm a board-certified plastic and reconstructive surgeon, and I specialize in aesthetic and reconstructive surgery of the breast. And as we go about our various clinical activities here in the office and in surgery, one of the questions that comes up quite frequently is the difference between a saline-filled and a silicone gel breast implant. So I think we'll utilize this episode of All About the Breast to highlight those differences so that you can understand the advantages and disadvantages of these two types of devices. That's what happens almost always. So one of the big questions that comes up when we're counseling people about breast surgery using breast implants, whether it's for cosmetic reasons, doing a breast augmentation, or for reconstructive reasons, say reconstructing after a mastectomy for breast cancer, the question becomes what kind of an implant do we want to use? And basically, while there's a lot of variables we could talk about, one of the big ones is the difference between a saltwater filled implant and a silicone gel implant. Now, the simplest version of a breast implant is, in fact, this. This is just a saltwater filled implant. You could think of it really as just a fancy water balloon. It's made up of an outer shell that's made of silicone rubber, and it has this fill tube right here at the top. And very simply, the way that we use this is we engage this valve and we get it right into the top of the implant, and then we can fill it very simply with a syringe, and we can put as much fluid inside this device as we need to make it function. So that is one of the advantages of these devices. They're really very easy to work with. Another big advantage is that when this is inside a patient, if the shell were to ever crack and develop a little hole, the water simply leaks out and is absorbed by the patient and is excreted in the urine. And basically what you get is what we call is just a flat tire. Your breast loses its volume, and that way you know the implant is ruptured. And it's really a pretty easy endeavor at that point, usually to go back and just replace it. So those are the advantages of a saltwater filled implant. The disadvantage really is it has a very watery feel to it, almost like a water bed you can feel, and it's really not very breast-like when it goes in. That said, it's amazing the kind of results you can see sometimes with these types of implants, as long as there's a lot of soft tissue cover. And I've seen these implants last 20 to 25 years in some people before they have to be replaced. Lately, there's been a new version of that saltwater filled implant, and that's this device here. This is called a serene implant. And basically, it's 4 different gradually enlarging shells on top of one another that are all intercommunicated. It still is filled with that same kind of a valve, but because of the different shells, the fluid doesn't flow quite as readily as it does with a typical saltwater filled implant, so it maintains its shape a little bit better. So you can put that upright and it's really not going to wrinkle anywhere, which is a big advantage, because I think you can see that as a saltwater filled implant, traditionally speaking, is put in, it has a propensity to wrinkle, and you can see those through the skin. This goes in and really doesn't wrinkle hardly at all. And I think this was a great advance, moving from the traditional saline implant to this multi-shelled version. And we've used this with great success in our practice for those people that wanted a saltwater filled implant, say they had some aversion to a silicone gel implant. This ends up being an absolutely tremendous option. So we have that available as well. But really the most significant history with relation to breast implants has been the silicone gel device. This is the devices that were originally made back in the 60s. And it's done so because really the silicone gel that's inside this implant is just an inert substance. Basically, this just takes up space with style. So it's still that same silicone gel outer envelope, but it's just filled with a silicone gel. Now, the question oftentimes comes up, what does that gel look like? And so what I've done here is I've actually taken an implant like this and cut it in half. And you can see that there's a fair bit of cohesion to this. It's almost a little bit like bubble gum, like that. And so if this ruptures, it doesn't really go anywhere. It pretty much stays inside the pocket, which is one of the big advantages. Historically speaking, I've got this device here, which goes all the way back to the 60s. And this device was filled with a super soft silicone gel. You can just get the sense that that's just very flimsy and soft as you compress it. And that's an advantage when you're trying to create a soft breast, but this was not very durable, and there was a very high rate of rupture with these devices back in the 60s and the 70s, and that's why we went back to more of these kind of devices that were just a little bit more sturdy. And so there's a long history of these devices. They worked extremely well. Back in the early 90s, there was a question about whether or not these could actually cause a systemic disease. That was largely disproven through various studies. There's now a resurgence of that kind of comment with regards to these devices, and uh, again, research is being done actively to look to see if women can be reacting badly to the silicone gel that's inside this device, and up to this point, nothing's come forward. This is related to the breast implant illness topic that's out there. Women who present with that and ask to have their implants removed, a fair number of them actually do feel better, but we just don't have any reason why or if there is any evidence that people are behaving badly with this device. So this tends to be the gold standard when we start to use implants for breast surgery. It's got a very soft feel. And the other thing is it comes in various kinds of configurations. So you can see that this one here has a little bit more projection to it than this one does. So for a lady that has a fair bit of skin over her breast, you put this in and it's going to fill that skin envelope a little bit better, whereas a flatter implant like this might allow that implant to drop off the bottom. Conversely, if you have a flat-chested lady, not a lot of breast tissue, you couldn't really squeeze that underneath that soft tissue very well. It would look too stuffed and round, and that's where you need this lower projecting kind of device to go in like that. In addition to that, there's been recent advancements in implant technology. So this is a typical implant from the 2000s, early 2010s. Silicone gel implant, silicone gel inside, fairly soft, but it's fairly underfilled. It's not filled as much as it should be. Advancement was made in these devices where they were filled a little bit more. And so as a result, they tended not to wrinkle at the top. This is something that we use almost exclusively now. It's called the extra implant because it's filled a little bit extra and is associated with a very low rupture rate and really excellent cosmetic results. And then lastly, there's this device, which is called the Boost. And the gel inside this particular implant is manufactured to be just a little bit stiffer. So it feels a bit stiffer when you put these in your hand. You can feel that the Boost is a little stiffer than the regular one. That's going to also hold up very well across the top and not create many wrinkles. So we'll use this kind of an implant for patients that want a little bit more extra upper pole fullness. So you can pick your implants based on what you're trying to achieve. Just to complete the story, now that cohesive gel implant has been manufactured into something that I'm sure everybody's heard about, the gummy bear implant. And the gummy bear implant is nothing more than an implant that's got a cohesive gel. And because the gel is a little bit stiffer, you can manufacture it into these anatomic teardrop shapes so that you can put that on the chest wall and it will create that nice teardrop shape that we're trying to create when we do breast surgery. And again, these come in various projections and sizes as well. One unique feature of the gummy bear anatomic implants, though, is that they all come attached with this textured surface. And that textured surface is a bit like Velcro. It was designed to help hold it in place like this so that it wouldn't rotate. Because I think you can see that if an anatomic implant rotates, that's going to be a problem as far as the shape is concerned. There's been a recent development of a type of an inflammatory cancer associated with textured surface that has been linked to these kinds of textured devices. And so for many surgeons, this is really off the market as far as a choice is concerned until that issue is completely settled out. And the advantage there is that there's never been a case of that type of a problem with a smooth-walled implant. So at the end of the day, the gold standard now for all kinds of breast surgery, whether it be breast augmentation or reconstructive breast surgery, is the silicone gel breast implant. So that's just a brief introduction of the different kinds of devices that we have available to us. In other videos, I think what we'll do is we'll talk about more in depth the difference between these textured devices and smooth wall devices. So certainly feel free to join us there. So if this video was at all helpful, please hit the like and the subscribe button so that we can bring more of these kinds of videos to you to enhance your understanding of aesthetic and reconstructive breast surgery. And we'll see you next time.